This vaccine helps prevent serious infections caused by a certain bacteria, Bacillus anthracis, in people who may be exposed to the bacteria, such as military personnel and lab workers. It may also be used with antibiotics to prevent infection after exposure to the bacteria. This vaccine contains parts from Bacillus anthracis and works by causing the body to produce its own antibodies against the bacteria. The recommended dosage is 0.5 ml per dose, administered intramuscularly. The best time to take this vaccine is when recommended by a healthcare professional. Before receiving the Cyfendus, National Stockpile, 0.5 ml per dose intramuscular suspension anthrax vaccine, make sure to consult with your healthcare professional and read all the available vaccine information. If you have any questions, don't hesitate to ask. This vaccine is administered by injection from a healthcare professional, either under the skin or into a muscle, depending on the brand and your medical condition. To ensure the best protection, vaccines are usually given in a series of doses. It's important to closely follow the vaccination schedule provided by your healthcare professional and keep all scheduled medical appointments. Consider marking a calendar as a reminder to help you stay on track. Some side effects of Cyfendus, National Stockpile, 0.5 ml per dose intramuscular suspension anthrax vaccine may include pain, redness, or swelling at the injection site, limited arm movement, muscle ache, headache, or tiredness. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears just after receiving the vaccine injection. If you experience any of these effects, it is important to notify your healthcare professional. Sitting or lying down may help alleviate these symptoms, as they usually do not last long. It's important to remember that this medication has been prescribed because your healthcare professional has determined that the benefits outweigh the risks of potential side effects. While a serious allergic reaction is rare, seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you notice any other effects, you should contact your healthcare professional for advice. Before getting the Cyfendus, National Stockpile, 0.5 ml per dose intramuscular suspension anthrax vaccine, make sure to inform your healthcare provider if you have any allergies to it, latex, or any other allergies. This vaccine may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Inform your healthcare provider about your medical history, especially if you currently have a fever/illness or if you have immune system disorders such as HIV infection, certain cancers like leukemia/lymphoma, or if you have had cancer or radiation treatment. It's important to note that this vaccine is not recommended for use during pregnancy, as it may harm an unborn baby. It's best to consult your healthcare provider for more details. It is currently unknown if this vaccine passes into breast milk, so it's important to consult your healthcare provider before breastfeeding. As always, it's essential to follow your healthcare provider's recommendations and ask any questions or concerns you may have about this vaccine. It's important to be aware that Cyfendus, National Stockpile, 0.5 ml per dose intramuscular suspension anthrax vaccine may interact with other medications, which could affect how they work and increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's essential to keep a record of all the products you use and share it with your healthcare professional. It's crucial not to make any changes to your medication dosage without consulting your doctor. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. Be sure to discuss any potential interactions with your healthcare provider. Cyfendus, National Stockpile, 0.5 ml per dose intramuscular suspension anthrax vaccine is used to prevent anthrax disease in people at high risk of exposure. This vaccine is given as part of a series of shots to provide extended protection against anthrax. It is important to receive all doses in the series to get the best protection. The usual schedule is for 6 doses at 0, 1, 6, 12, 18, and 30 months. This vaccine is given as an injection into a muscle by a healthcare professional. The best time to take this vaccine is according to the schedule recommended by your healthcare provider. Like all vaccines, the Cyfendus 0.5 ml per dose anthrax vaccine may not provide complete protection to every individual who receives it. This vaccine is used to prevent anthrax infection in people who may have been exposed to the bacteria through their work in certain industries, such as agriculture or animal handling. The recommended dosage is 0.5 ml per dose, administered through intramuscular suspension. It is important to follow the recommended schedule for the vaccine to ensure maximum effectiveness. It is best to consult with a healthcare professional for the optimal timing and dosage for this vaccine. Make sure to receive each dose of the Cyfendus, National Stockpile, 0.5 ml per dose intramuscular suspension anthrax vaccine as per the schedule provided by your healthcare provider. It is important to ask your healthcare provider about the timing of each dose and mark it on your calendar to ensure you don't miss any. This vaccine is beneficial in providing protection against anthrax and should be taken according to the recommended dosage and schedule. Remember to store Cyfendus, National Stockpile, 0.5 ml per dose intramuscular suspension anthrax vaccine in the refrigerator, but do not freeze it. It's important to keep all medications away from children and pets. Also, do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When this product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.